accreditation process. Joining us today is a true expert in the field, Jennifer Flowers. Jennifer is not only the founder and CEO of Accreditation Guru, but she's also a valued member of our BestNotes Clinical Advisory Board. With over 15 years of experience, Jennifer has helped organizations across the US and abroad achieve accreditation with the Joint Commission, CARF, and COA, ensuring that they meet the highest standards of care and operational excellence. So, throughout today's session, Jennifer will be sharing insights on accreditation best practices, common challenges organizations face, and how to streamline the process for success. If you have any questions that come up, please add them into the Q&A section. We've reserved the last 10 to 15 minutes of the webinar for Jennifer to answer as many as possible. And just for a note, this webinar is being recorded, so if you need to step away, we'll be sending out the replay in the next day or so. And with that, let's get started. Please join me in welcoming Jennifer Flowers.
Excellent. Thanks, Nicole. Hi, everyone. I'm glad you're with us today. And as you can see on the screen, we'll be speaking about new accreditation standards for behavioral health providers. And just to give everyone a quick overview of what we'll be doing and speaking about, there we go. The agenda for today, we'll be just talking briefly about the benefits of national accreditation for behavioral health organizations, making sure that everyone understands the whys behind why you might want to go through this process. We will definitely be talking about new standards from CARF, Joint Commission, and COA, the role of technology in accreditation, and best practices to align your organization with the evolving standards. And as Nicole said, we will have time for Q&A, so do put your comments and questions in the chat, please. And I think it's helpful for us to get a bit of a feeling for who is in the meeting today. Nicole, I think we've got a couple of poll questions that we might be able to toss up for folks. Okay, so you've got the what is your organization's accredited status? And there's a multiple choice. If you just scroll down, you'll be able to select your options, whether you're fully accredited, in process, not accredited but considering it, or not accredited and not planning to pursue accreditation. Those might be the folks that want to run for the hills when they hear the word accreditation. And then also on there, if you are working on accreditation or already accredited, with which accrediting body. Nicole, give people a couple of seconds to fill this in. Again, this is helpful to understand kind of where folks are for today. Okay, so let's take a look here. Fully accredited at almost 70%. Excellent. In process, not accredited. Great. And we've got Joint Commission. CARF is leading with almost half. Other and not accredited. Okay, that is helpful. I appreciate it. Thanks, everyone. So let's jump into this. Just briefly, you might be aware of Accreditation Guru. This was our previous logo, but late last year, we did go through a rebranding to coincide with our 15th anniversary. So just want to make that tie in for you. Let's talk about the strategic benefits of national accreditation. And I think this is important to go over because there are a lot of different reasons why organizations will choose to be accredited. Some do it because of a state or federal mandate, but there are a lot of benefits. And I've seen organizations that have gone through the process from where they started to where they ended up, and it has completely transformed their organization. So with this, also, so that you know, when I'm speaking about accreditation in general, we will talk about specifics with Joint Commission, CARF, COA. But for most of the slides, we're talking about kind of all three accrediting bodies. And there are other accreditors for behavioral health organizations, but kind of want to give you the broad overview. And there are standards that speak to enhanced service delivery. The accreditation approach promotes adherence to evidence-based practices, and that can improve the quality and consistency of your services provided. Risk reduction and mitigation. Inevitably, I see that groups going through accreditation have a much more robust and in-depth approach to risk mitigation than what they were just doing on their own. There's a streamline for processes and efficiency. You'll be looking at your policies, plans, procedures, making updates where needed, and that can help with the efficiencies of the work that is being conducted. Accreditation helps promote better staff performance and engagement. There are standards from all the accrediting bodies that speak to staff training, be it orientation and ongoing training, recruitment efforts, supervision. I personally know staff both at the frontline level and in leadership that only want to work for accredited organizations because they know that that company has gone the extra mile and is committed to quality operations, quality services. And that goes to attracting your higher caliber of professional staff. And then data-driven decision-making. All the accrediting bodies have standards to speak to outcomes measurement, performance improvement, and having a process to collect and analyze and make decisions on data points, not just on anecdotal evidence or hunches. We really want to make sure that we're making decisions that are factual and data driven. And a few other benefits are increased credibility and reputation. Accreditation is something that once achieved, you should have on the homepage of your website, put in your newsletters, put in any advertisements for new employees. And it lends to the credibility of your organization having gone through this national review, which takes your organization above and beyond being licensed. We can find improved funding and contract opportunities. Some funders require that organizations are accredited in order to receive reimbursement. Others will encourage it. Some nonprofits may find that there are grant opportunities specifically for accredited organizations. And I also know some grant-making organizations that while they don't specifically list accreditation as a requirement, they do use it as an internal kind of selection criteria. So if you have 100 applications coming in for a grant and 20 of the organizations are accredited, they'll cull the group to those 20 and then make their final determinations. With strategic growth opportunities, all of the accrediting bodies have standards and requirements that speak to strategic planning. And when you're going through this process and looking at your organization and the effectiveness of your programs, you may determine that there are opportunities to offer new programs and services, partner with other organizations, perhaps merger and acquisition opportunities. One of the other benefits is enhanced information technology and data security. And Isaiah Olson from BestNotes will be speaking to that specifically. And then ongoing compliance readiness. Organizations that are accredited tend to be in a better position to deal with changes and new regulations coming down from the states, coming down from federal regulators. I happen to know that many accredited organizations were in a better position to deal with the COVID pandemic. When that hit us, nobody was expecting that to happen, but because those organizations already had an in-depth approach to risk management and had committees in place and had improved communication within their organization, they were better able to make those important pivots. And the importance of persons serve their families and communities. More and more individuals are understanding the importance of accreditation and what that means, that there is the commitment to quality and safety, that there is often a higher level of treatment being provided, that you've gone through this external review, that you've had this kind of gold star recognition. And it also helps to differentiate you as a provider from others in the field. And there's one story that I like to give. So with a company named Accreditation Guru, sometimes we get missed calls. People are just looking, they're thinking they're calling an accrediting body or other outlet. And there was a call that we received, it was on our main number, and picked it up. And a woman was asking about an addiction treatment provider in Utah because she was sending her adult son on a plane in the morning. And you've got that short window of opportunity. He'd agreed to go. She knew nothing about this organization. It had been recommended to her. And the woman was in a panic. I could hear it over the phone. I said, "Oh, I don't know this provider, but quick, let me look it up." And I went online, pulled up this organization, and on their front page, it said they were Joint Commission accredited. And so I was able to tell her what that meant and the fact that they'd gone through this external review. And I could hear this woman audibly sigh. And she said, "I feel so much better putting my son on a plane." So it is really important to people out there whenever they have an opportunity to select where they're going to be receiving vital services. And accreditation standards and conformance. Okay, that was a bit of information. Before we get into the standards themselves, Nicole, can we pause here? I think we've got one more poll for folks. Just when you're thinking about accreditation, what might be some challenges that you have in mind when it comes to going through this process? It's a big undertaking, but if we can toss up that poll, that would be helpful. Great, thank you. So folks might just select, when you're thinking about accreditation, what might be some challenges, the cost, the time commitment, meeting documentation requirements, and just understanding the process itself. And I promise you the standards are not written in Greek, but sometimes they might seem that they are. So. And I do understand that it is a commitment of time, money, and effort to go through this process. All right, are we getting answers coming in?
Yep. A lot of documentation requirements.
Yep. Yep, a lot of documentation, understand the process, time commitment, cost. Okay. All right, this is helpful. Thank you, everybody. All right, let's talk about the standards themselves and conformance with the standards. So very briefly, each of the accrediting bodies have a similar process when it comes to standards development. They will research, review research that's already out there in professional literature and keep up on evolving trends and practices. They will collaborate with diverse groups of subject matter experts that they have in their own mix. They will put new or revised standards out for a period of field comment. And then there's ongoing feedback from accredited agencies and volunteer reviewers. And oftentimes there is an annual release of new or revised standards. If something happens and the accrediting bodies feel they need to push something out mid-year, they will. They reserve the right to, but they tend to kind of hold on to any changes and release them all at once to make it easier for the accredited organizations to manage. And sometimes there will be small adjustments here and there within the standards. Other times they might revamp an entire section or sections of standards. And you just need to know that you need to keep up on anything that is new or revised when it's released. And the focus of the standards, really, they look at your organization from top to bottom and left to right. So you've got the administration and management business practices, the service delivery administration and the environment in which you're providing services. And then there's standards that speak to the programs and services, as well as any unique populations served. But keep in mind that the accrediting bodies and their standards are not telling you how to deliver your programs and services, but there are parameters for what should be accomplished when delivering your programs and services. So if you have a very unique organization or a unique approach, that's okay. You can keep that while being accredited. And a few recent standard updates. Again, we'll be speaking about CARF, COA Joint Commission. And with Joint Commission, in July of this year, there will be streamlined chapters released having to do with infection control and emergency management. Also, what was just released are revised requirements for behavioral health and human service organizations who are involved or have restraint and seclusion practices. They want to make sure you have a plan for reducing or possibly eliminating those whenever possible. They have put out new and revised standards on workplace violence prevention, and they had a new program put out for telehealth accreditation, and that is for those organizations that are only providing telehealth services. And with CARF, there have been some standard revisions in terms of the finance, health and safety, and accessibility of your services. And those are in what CARF calls their Aspire section that speaks to your business practices. There are new shelter standards, measurement informed care standards are new, and they revised their intensive family-based standards. And then for next year, in 2026, there'll be the integrated primary care standards with a specialty designation. I think that's a really important one for behavioral health, especially. And then home health standards will be updated, and home and community services will also be updated. With COA, and sorry, I sometimes switch between COA and COA. It's used interchangeably around the country. Mental health and substance use services have been revised, and they include a section on CCBHCs, the Certified Community Behavioral Health Clinics. And COA, CARF, and Joint Commission all do now have standards that speak to CCBHCs. With the standards for the IDD services, those are better revised to address personnel competencies, inclusions of workers with lived experiences, caregiver family education support, and delivery of individualized therapeutic interventions. And then the domestic violence services were revised to include practices to promote survivors' well-being. And COA has a link of all of their recent standards updates. They will also be releasing new standards in the areas or revised around early childhood education, case management, workforce development, and revisions for the for-profit organization standards. And those address effectively the business practices of for-profit organizations because they are different from how nonprofits operate. Okay, so we're going to do a little shift here with the role of technology in accreditation. And I'm going to be turning this over to Isaiah, who will be addressing these key areas. And we do have a note on here that if you're looking for more in-depth understanding, you can contact the team at BestNotes or give them a call. So I'm going to stop sharing and let Isaiah take this over for a little bit.
Thank you, Jennifer. And everybody, my name is Isaiah. I am the lead of the content management team here at BestNotes. I'm honored to be presenting today with Jennifer and the Accreditation Guru team. I had the pleasure of meeting her at a recent conference, and based on our conversation then, it just further deepened my appreciation for the work that they do, so thank you. I'm going to go ahead and share my screen here. I thought she asked me to speak briefly about the role of technology in the accreditation process. And I thought, specifically I'm going to talk about EHRs and BestNotes, but I thought I'd start with the top of the sort of flow of treatment at your typical behavioral healthcare facility, right? So in my mind, that's the admissions process. And when we're talking admissions, I wanted to take a little bit of time to talk about patient portals, client portals, parent portals. These allow clients to interact remotely with their treatment, right? So they're able to apply conveniently and online for services. They're able to receive their medical records, and they're able to sign consent forms and documentation. This is all, of course, a component of meaningful use, but is also a part of some of the accreditation requirements. Now, what I'm showing you on the screen now is our BestNotes portal demo account. Of course, your facility's logo would be at the top here. And what I'm showing you on screen now is our pre-screen application. So this would be their application for services. Now, if you are utilizing BestNotes clinical documentation set, you will have access to this application. I'll speak a little bit more about what that documentation set is in a few minutes. But this application is going to allow these clients or their parents to give you all of their demographic information, up to 6 related contacts, including an emergency contact, their presenting condition and medical history, as well as their behavioral health and substance use history. And once they're done with this application, they'll be able to submit that. Your facility will receive a notification that an application has been submitted, and they'll be able to process and import that directly in BestNotes. So having the technology of a client portal is a big deal here, especially when we're talking in terms of telehealth and the ability to remotely interact, right? So like I said, this application will import directly into BestNotes. You would be able to go down here to your admissions tab. You'll receive that notification. You'll be able to import that document. It'll pre-fill or update their client chart. If a client chart has not been created, it will actually create one for you in BestNotes and fill their demographic information as well as their related contacts. And it will also import their application into this pre-screened document in the MedClinical. And this brings me directly to my next point, which is clinical documentation, right? I saw in that poll, the majority of the concerns with accreditation was keeping up with the documentation standards. So at BestNotes, a way that we've tried to alleviate that burden is we've actually created our own documentation set that we manage and keep compliant for you. And this is what Jennifer and Accreditation Guru have helped us tweak and fine tune to maintain compliance with those standards over time. What I'm showing you again is this pre-screen intake assessment. Everything you're seeing on the left side of the screen here, if you are subscribed to our clinical profile documentation set, you will have all of these documents. If you are not subscribed to our profile and this sounds like it would be useful to you, please reach out to us. There's no charge, there's no additional cost to anything I'm going to show you today, okay? So like I said, this pre-screen will import from that application. It of course could also be completed in person or via phone interview. And what's really cool about the clinical documentation in BestNotes is 100% of this client self-reported data that comes here in this intake assessment is going to flow downstream into your CDA, into your biopsychosocial, and from there it's going to go even into the psychiatric, H&P medical, and ultimately the master treatment plan. I'm going to touch briefly on the CDA here. I want to talk about a couple of things here. So another great thing about our documentation is, like I said before, we keep it compliant for you over time, and we will actually push updates to this documentation as new standards are released from these accrediting bodies. So most recently, Joint Commission released their new provider manuals in July. We actually added a couple of questions to our documentation to remain compliant with that. And those are questions about medications for drug or alcohol withdrawal. And you can see we added those two questions here. They're present on our application and they're present throughout the rest of the documentation. Another thing I want to point out here with the clinical documentation is this red text. You'll see it all throughout the assessments. This is what we call provider-facing prompt text. So it's just a guide for your providers. Hey, pay a little bit more attention in this area. Make sure you're covering all of these aspects so that your documentation will be robust and compliant when it comes time for those audits or those surveys. I could talk about clinical documentation all day, and I'm happy to do so. If any of you would like to schedule with me, just email team@bestnotes.com. I'll make some time. But let's move on to my next point in the sake of saving time. The next piece of technology I want to talk about that's important when it comes into accreditation is outcomes and outcome measuring. BestNotes has a service called Outcome Tools, which is integrated with BestNotes. I hope you're all familiar with this. If you're not, I'm going to just show you briefly on bestnotes.com. If you hit over here on our features dropdown, you can click on Outcome Tools, and here's a list of all the standardized questionnaires we have available for you. We also keep these updated over time. A lot of them are automatically scored. Outcome Tools has a robust feature, reporting features. It'll plot graphs for you. There are multiple delivery methods for this, so you can send these surveys to clients via their email. You could even send them post-discharge and gather that post-discharge data, which is super important for measuring effectiveness of treatment. We've got things like COWS, CWA, CSSRSs, GAD-7, PHQ-9. Any of these outcomes questionnaires you need, we probably have them. When you do have outcome tools, you will get this tab right here in your BestNotes. And you can see here, my BestNotes is freezing up. Okay, here we go. You can see here a list of all of the surveys that have been completed historically. You can also assign an instant survey right from this list. And of course, this list is curated by your facility depending on what surveys you guys need. I'll go ahead and click on one of these PHQ-9s here that was completed on Jane in January. And if I click on this, it'll actually pull up and not only display the answers they gave, but also in this case, a score, a severity rating, and a consideration, in this case, major depressive disorder. Again, if you're interested in learning anything more about outcome tools, please reach out to us. This is included in the cost of your subscription, so make sure you're taking advantage of these tools. The next thing I want to talk about briefly is reporting. And of course, Outcome Tools has its own set of reporting features. but reporting within BestNotes itself on the client chart data. I'm going to hit reports here in the bottom left, and you're going to see a pretty massive list of library reports we have built in. Again, if you're curious about any of these, reach out. But the two I want to focus on today are the client chart audit and the log review reports. So I'm going to go ahead and click on this client chart audit report. And right away, I'm going to see a bird's eye view of my clients for this month. Now, by default, it's set to the month of February. Of course, that's the month we're in. And I'm currently logged into BestNotes as Justin Spiegel. And so it's defaulting to showing my caseload as Justin Spiegel, right? And so I have a total of 9 clients. I could show all of them. If I change the provider here, you'll see that number jump up to 92. But in this case, let's stick with Justin's here. We're gonna take a look at his. So this is a demo account, so there's not a lot of data in here. Let me find one that's pretty good. I think Don Mahomes is a good example. So with this client chart audit, I can see that Don had a individual therapy session at 8:45 a.m. with Justin. He was checked in, and I can see that a clinical progress note was completed in conjunction with that session, and that it is signed and locked, meaning it's completed, it's finalized. If that note had not been signed, that yellow padlock would be green and unlocked. And so at a glance, I can go through here and quickly make sure that documentation is being completed in a timely manner and in conjunction with the sessions that are happening. We can see his start date was today. He was also enrolled in outpatient on the 7th. He had a case management assessment completed, a case management progress note, and he signed his admissions paperwork that day, which makes sense, right? So that's great. I'm going to move on to the log review report. Again, any questions on this, reach out to us. The log review report is really great for just auditing and making sure that documentation is being completed in a timely manner, making sure that things are getting signed. And I'm going to show you how this works just briefly here. So again, the date range is automatically set to just today. I'm logged in as Justin Spiegel, so that's the user. I'm going to take this date range just back to January 1st, and I'm going to keep the log type on all, no appointments or media. Again, I could filter for a specific piece of documentation if I wanted to. So if I was trying to find out, hey, when's the last time we did a treatment plan review for a client? I could filter for a master treatment plan, and I could display the log date to the day, and that will show me how many days it's been since this client has had a treatment plan review done, which is great, right? Having those timely and scheduled reviews is also an important piece of accreditation. So I'm going to go back to all no appointments or media. I'm just going to hit go here for the month of January. Now, because I'm grouped by log status here, at the very top, I'm going to see all of the documentation for Justin that was created but was never saved, signed, and locked, right? And so all of these green padlocks are what I don't want to see. I can see, so there was 4 clinical progress notes that happened that Justin created for these clients here on these dates, but they were never completed. I can actually click on any of these to jump directly to that note. I could review the content of it. In this case, it's blank. Maybe it was created in error. Maybe it just needs to be finished. And then I can jump right back to the report, hit the next one, and have that oversight, right? As I scroll down here, I'll see all of the lock documentation. A lot of these are just created by, and that just means that the contact was created by Justin on this date. But as I scroll down here, we'll get to the locked and signed portion. I can see that Justin signed all of these documents. I can see that the client signed some of them. If the client was added as a signer but did not sign it yet, they'll show up as pending here. So these are just 2 reports I really like and I think can help with the documentation issue and making sure that things are being completed and finalized. Again, there's a ton here to look through. Feel free to take a look at these and reach out if you have any questions. The last thing I want to talk about today is interdepartmental coordination. I think that's a big piece. And if I open up the Med Clinical again here, the first thing I want to say is that all of our clinical profile documentation is co-occurring and capable. So if they're a behavioral health client, if they are a substance use client, if they are both, this documentation will work for you. And the other thing I want to point out is that we have different assessments for different disciplines, right? We have a psychiatric assessment that can be completed by a psychiatrist or a nurse practitioner. We have a history and physical exam that can be completed by a medical doctor, a medical exam or a medical assessment or a nursing assessment to be completed by nursing staff. And all of these documents ultimately feed into our multidisciplinary master treatment plan. And so all of the departments are ending up in this area, which is the ultimate source of truth. You can see at a glance what's happening for this client across disciplines. We've got areas here for strengths, needs, abilities, and preferences, initial goals, and safety plans to come from all of those assessments. And ultimately, when we get down to the master problem list, you have the different departments coming together. So we've got alcohol use disorder as a clinical problem. We've got diabetes as a medical problem, and we've got a case management problem, all with associated goals and objectives. So you can see at a glance what's happening across departments for this client right here in our master treatment plan. Now, if you wanted to come in here and just quickly get to what you're trying to do, so if I'm the clinician and I'm just trying to update an objective and publish a treatment plan review, I may not want to see all of this other content. So we've added a filter here, and I can just filter for clinical. Boom, it's reduced to my department. I can quickly get to my objectives, update these, and publish my treatment plan review. One other piece as far as interdepartmental coordination would be, if you come to the calendar, you have access to this Q log, which is a messaging service within BestNotes. It's all HIPAA compliant. And so I can send messages to my colleagues, to other providers right here from BestNotes. I can attach this to a contact specifically, create a subject. I can add other users of BestNotes, other providers to this, and we're able to communicate in a HIPAA compliant manner. That's all I have. Thank you, Jennifer. And again, I'll say it for the 50th time. If you guys have any questions on any of this stuff, please reach out. If you're not utilizing any of these tools, we can get you set up. Just reach out. Thank you.
Awesome. Thank you, Isaiah. All right. That was great information. And one note is none of the accrediting bodies require that you use an electronic record system. It is very helpful for accuracy of information, reporting, tracking of outcomes, etc. Okay, we're going to keep going on this and talking about aligning your organization with evolving standards. And what are some challenges often faced? That organizations have documentation and record keeping gaps, that you might update your policy and procedures once, and then sometimes things shift over time, operations change, but you're not keeping up with having your policy and procedures in line with current operations. Staff training and development. There are, I hear this often. Yes, we train our staff. Yes, we help them with development, but we don't have it officially documented. It's done informally, or it's done in team meetings. The old adage, if it isn't documented, it didn't happen, definitely applies to accreditation. So when you're having formal supervision, formal training, and even if it's on the informal side, make sure you're documenting it. Policy and procedural alignment, that's if you have something written down, but staff are not following them. That can be a problem. And you can have the most beautiful policy and procedure manual, but if your staff are operating just on their own or off a different set of policy and procedures, there's going to be a problem there. Resource constraints, that can be a challenge. People, I'm sure everybody on this meeting today is already working at 110% as is. So where are you going to find the time? Where are you going to find the extra dollars in the budget? All of this to not just prepare for accreditation, but practically maintain it. And data collection and quality improvement. Oftentimes we see that groups might be collecting a ton of data, and they might be looking at it, but they're not drilling down and really utilizing the data and then making decisions and then going back to check, did any changes you implement have the desired effect? So the accreditation standards speak to that entire cycle of quality improvement and data management. And not keeping up with changing standards. That's another one. As I said, it's often once a year that comes out, you need somebody internally, or if you're working with a consultant, that's one of the services we offer, is making sure you're keeping up with the changing standards when they come out. And a few tips for success. I mean, yes, you want to understand the standards and the why behind them. It might not be the most exciting reading, but there's a lot of specificity within the standards, and we need to understand why we're doing this and how it benefits your organization. Conducting internal audits. You want to document everything, but put in here, be reasonable. You not need an emergency response plan that is 220 pages long, because your team will not be using it. And everything that you develop is for your staff. You're not writing policy and procedures for the accrediting bodies. And you need to also focus on the core standards and standards related to high-risk areas. All of the accreditation standards are important, of course, but there are certain that are more fundamental, more high risk that we want to be paying attention to. And we want to identify gaps in our policy and practices. So review the standards, involve all levels of leadership and personnel, conduct your gap analysis. So again, are your policy and procedures in line with both your operations and the accreditation standards? And if there are deficiencies, make those changes. And then use those internal gaps analysis and staff feedback and licensing reviews to uncover some blind spots. And we do have a free readiness assessment that's online. No commitment, takes about 8 minutes to complete, but it just asks some high-level questions of what you already have in place in terms of strategic planning, performance improvement, risk management, et cetera. You're welcome to scan and take that. And also, I'd like to offer for everyone who signed up for this webinar, if you'd like to have a free consultative 30-minute meeting to discuss accreditation, priorities, which might be the best accrediting body for your organization, et cetera, we're happy to do that for you. And I think we're good on time. Nicole, have we had some questions that have come through?
Yeah, if everyone could put their questions in the Q&A section, we'll be happy to get to them. I have a question though, Jennifer, as we wait for those.
Yeah.
So what are accrediting bodies' expectations between surveys for organizations?
Good question. Okay, so proactive maintenance of accreditation is expected by all the accrediting bodies. And you will either have 3 or 4 years between your full surveys. You be keeping up on the updated standards. There's an annual report that an attestation that you need to submit to your accrediting body. There are standards that speak to quarterly and annual reviews that you need to be keeping up on. And then again, documentation of staff training, et cetera. The real heavy lifting should be when you're going for accreditation the first time. Then if you're proactively maintaining accreditation, when you come up on your next review, it should be a matter of, tightening up a few things, conducting a mock survey, make sure everyone's ready, and then having a successful survey.
We've gotten quite a few customers that have come to us from another EHR. So how would that fit into that accreditation preparation?
So long as you are fully utilizing your EHR, that's the important thing. I think it's always hard to hear that, and not BestNotes, when people have an EHR and it's just okay, or staff aren't fully utilizing it. Making sure your staff is trained, making sure that the information is either transferred from one EHR to the other or is somehow still accessible. And again, it's not a requirement to have an EHR, but it's very helpful.
Great. How do you determine which accrediting body each organization should use?
Yeah, so we work with all the accredited bodies equally well, have great relations, and so I don't just recommend one over the other, but there are reasons why there might be a better fit for one or the other. CARF and Joint Commission each have a 3-year cycle. COA's got a 4-year cycle. Joint Commission tends to be a bit more medically based. If you have multiple programs and services working in behavioral health and other human services and child welfare, CARF or COA might be one that you would be looking to. I will also tell you that each of the accrediting bodies figure out their fees from an entirely different calculation and standpoint. I always recommend do not pick an accrediting body based on their fees. There's just so much more that goes into it. So you want to talk to accredited organizations in your state. If you're part of an association, talk to them. What are people's experiences? Have a conversation with the accrediting body and speak to them about their standards and how that might fit or not fit with your own organization and your own services offered. We can certainly help you make that determination.
Great. Have a question here about quality assurance. Should our organization do meetings every so often, and what should be included in them?
Yeah, I think it's handy to regularly schedule, and monthly seems to work well. If you're going on a quarterly basis, things can be popping up that you're not keeping an eye on. So I like having monthly data reports and then quarterly summaries and then an annual report so you can look at trends throughout the year and then year to year. And you want to be looking at data points that address the operations and management side of your organization and your programs and services. So it might be looking at staff turnover or where you are against budget numbers, et cetera. But then you also want to look at your client outcomes. So it's not just how many clients that you're seeing, but what are the data points that fully identify that you're making a difference in the lives of those that you're serving. So and you can add or subtract data points and adjust your reports throughout, but you want to have those discussions and decide what is really important for you internally to make decisions on how you're operating. And you can certainly use what you're reporting to the state as a starting point, but most groups need to make it broader than just what's reported to the state.
You gave us a wealth of information. Thank you so much, Jennifer. This was a wonderful webinar. How can people reach out to you?
So here's my contact information. This was great. I'm happy to have a conversation. As I said, we can set up a 30-minute call, and our goal is not only to see that you are successfully accredited, but that is done in the most effective, streamlined way possible. And we will make your life easier when it comes to accreditation. So this has been great. Happy to answer any questions that we didn't have a chance to get to. But Nicole and Isaiah, I thank you both for this opportunity.
Yes, thank you. And just had a last minute question about reaching out to BestNotes for further training on the reports area. Just so everyone knows, please reach out to team, that's TEAM @bestnotes.com, and we'll be happy to work with you. So thank you everyone for coming and have a great rest of your day.
Awesome. Thanks so
Jen.
much.
Thank you.
Bye.
Bye.